Have you seen a doctor through your smartphone before or your computer? What are some cases that you think don't require heading directly to the ER or to a clinic, but can be treated remotely? A new study conducted by Tel Aviv University, the University of Haifa, and Stanford University in California found that telemedicine reduces the need for patients to rush to crowded emergency rooms by 20% without harming quality of care, utilizing home-based medical examination equipment. Is that indeed the case, and for what kind of cases? Joining me in the studio is Dr. Yechezkel Weissman. He's the medical director for pediatricians online service at Clalit, which is one of the medical providers here in Israel. Thank you very much for being with us. Okay, so the analysis, I understand, encompassed the data of over 100,000 visits conducted by 28,000 people over the course of 3 years. What are some cases that you are confident that people can use remote digital services for, and what are some common mistakes that people do?
Thank you for your question. Let me say first that this was a collaborative study between the Division of Online Services at Clalit, the Clalit Research Institute and Innovation, and the University School of Economics at Tel Aviv University and Stanford University. So we really made this comparison, and the comparison was about trying to analyze the use of a new device called Taito device. This Taito Care enables making a physical examination from remote. What can we use it for? For ears, checking the ears, throat, heart, lung, and the skin, of course, and temperature.
So this is a device that you gave to those 28,000 patients that went through, took part in the research? They purchased it?
But with a significant discount.
Okay.
And they, of course, get the benefit of using it free of care. And so this service is about free of care for the patients. And if I may say, before we go into it, that I'm running this pediatricians online service since 2009. Mm-hmm. We at Clalit were pioneers in introducing this system of telemedicine for primary care visits, and this was an evolution. Okay. Initially, we started with telephonic, then video chatting, and now we can basically make a physical examination from remote.
Yeah, we only have about 2 minutes left, so I want to hear what this tool actually does. What is this device? Because you mentioned checking the ear, the heart, very different areas in the body. How does it work?
The family, they have it at home. They make they apply according to the instruction this device to the ears, throat, and heart, and so on, and it is transferred via Wi-Fi to a secured cloud and downloaded by the physician from this secured cloud. And they can talk, they can see each other, and also the physician can do the physical examination from remote. I introduced this device 4 or 5 years ago after doing a study where we compared physical examination of this device using this device and the regular physical examination. The agreement was perfect.
Perfect, 100%.
Not 100%, more than in certain, for the lungs, 100%. For the ears, less, like 70%.
So aren't there some cases in which digital services lead to wrong diagnosis and then to harsh consequences?
You know, mistakes can happen everywhere. And I've been running for 30 years an emergency department at Schneider Children's Medical Center. And, you know, it is human, but touch wood, we can say. We didn't have a significant harmful mistakes. It is convenient for the patient. We also use it in a sort of triage. Should you go to the emergency department or should you stay? Should you go to an emergency clinic? So it is not for like second opinion, it's just to use it for directing the patient where it would be the best treatment for him.
Dr. Rachel Weissman from Clalit, thank you very much for joining us.
You're welcome.